VA Health and Benefits mobile app.
Secure messaging. Do you delay taking care of common Department of Veterans Affairs healthcare and benefits tasks because you haven't set aside time to log into your home computer to do them? The VA Health and Benefits mobile app is your solution. Using your mobile device anywhere, anytime, you can quickly and easily send and receive secure messages with your VA healthcare team, review and cancel healthcare appointments, download VA letters, show retailers your veteran status, and more.
In the past, I would sometimes be my worst enemy. I would know that I needed to make a follow-up appointment, and I would just put it off. That would directly impact my healthcare. I wouldn't be getting the care that I needed. I wouldn't be going to the appointment that I never made. But even more so, I would dwell on it. It impacts your mental health to have that on your mind and just not do it. And that directly impacted my healthcare and directly impacted to where I would have lapses in medication that would impact my life, my family's life. So having that much more real-time like conversation with your provider, it just happens. It happens seamlessly. It's more aligned with how our everyday life works with our text messaging and our sort of asynchronous communication that we still want to happen rapidly.
It's one of those features that I routinely use just to keep my VA healthcare team abreast of what's going on. So it allows my primary care manager at the VA here, I can instantly message him while I'm at the doctor at Mayo and let him know the updated status, any change in my prescriptions, oxygen that I'm on. So I'm able to let him know immediately what's happening at the other locations where I'm going to receive care. It keeps my healthcare team at the VA on the same page, where before it was really challenging because I would have to wait till I got home, log onto my computer, where now I can do everything from my phone. So while I'm waiting for my next appointment at Mayo Clinic, I can actually shoot my doctor at the VA a message via the online app.
I think it's a more sense of ownership and accountability that they can have an active part of engaging with the VA at a higher tick, just to be honest. I think in years past it's been well, I have to sign on this website, or I have to go there, I have to talk to somebody. Now it's literally on your couch. And that just gives folks more sense of again, ownership and accessibility, which I think is huge.
Let's take a closer look at secure messaging. This feature allows you to securely communicate with your VA healthcare teams regarding non-urgent healthcare-related questions, all conveniently using your mobile device. Never miss a message again. Managing your healthcare has never been faster, easier, or more accessible.
To access mobile app secure messaging, log in to the VA Health and Benefits mobile app. Select Health, select Messages to view your inbox, reply, or compose a new message. Select Compose a Message to send a new message.
Just like on My Healthy Vet, you should receive a response from your VA healthcare team within 3 business days. You can also access your inbox and all the same premium account features on your computer using the web-based secure messaging feature in My Healthy Vet. Don't have the VA Health and Benefits mobile app yet? Getting it is free, fast, and easy. Visit the Apple App Store or Google Play Store. Search VA Health and Benefits. Follow the directions to install the app on your mobile device and sign in as you normally do, or create an account at login.gov. That's it. Now you're ready to access your VA healthcare and benefits from your mobile device.
For more information about the VA Health and Benefits mobile app, visit https://digital.va.gov or scan the QR code.
Note: VA is modernizing its electronic health record, which may impact whether the My Healthy Vet and secure messaging feature on the VA Health and Benefits mobile app are operational in your area.
To learn more, visit the EHRM website by scanning the QR code.